All right, we are taking your questions about the latest COVID trends and flu and how you can get ahead of all of that. As a reminder, that number is right there on the bottom of your screen, and our cone health expert is Dr. Cynthia Snyder answering your questions. All right, this first question is either booster more effective than the other?
So we know that there's probably some beneficial to obviously any of the boosters. The mRNA boosters of Pfizer and Moderna are considered bivalent, and they include some of the latest Omicron subvariants, including BA.4 and BA.5. So in theory, that might be more effective
than the Novavax.
Correct.
Okay. This next question is, since the timeline for kids is different, should parents pick the shorter series? Are they equally as good? So should they do the Novavax since it's a shorter time span, or does it really matter and they can do Moderna and Pfizer, doesn't matter?
So the children's series there are some differences between the various ones, and I would choose a shorter one because we're heading into a very significant respiratory virus season, as well as right now there's a very high RSV burden in our community.
So yeah, it might have been different if it was like the start of summer or something like that, when you're going to be outside and it's not as cold and you're not inside as much. Okay, I understand that. This next question is, are the side effects different for the boosters? Like, is the Novavax, does it have different side effects than the other mRNAs?
I would imagine, since all the vaccines are really stimulating your immune system to produce antibodies and rev up your T cells, the side effect profiles are very much the same across the board.
Okay. This next question is, do you recommend mixing and matching or staying with one series?
That is a very good question. You know, it's been debated among both infectious disease docs and different immunologists. And the thought about changing your series up is that your immune system may create different antibodies. So there's some theoretical benefits to it.
Okay, so it's kind of like really what you want to do, but you're laying it out there of that's what the thinking is.
Correct. And I'm a fan of, you know, that kind of makes sense, but I'm not sure if the data supports it yet. Mm-hmm. And then also, it's also about accessibility. Like, if I'm ready to go get my booster and there's only one available, I'm sure I'm just going to get that.
Mm-hmm. So this next question is, should we be concerned about the myocarditis in men after this new booster? So that was talked about some earlier on with some of the mRNA ones. Are we concerned about that with the Novavax?
So they're seeing less of it in the Novavax arm, and again, it was really seen more in adolescents, and if somebody has had, for instance, that side effect with an mRNA vaccine or some significant like allergies, then the option would be to switch over to the Novavax vaccine.
Mm-hmm. Okay. And so this next question is, does the new shot, the Novavax, give you a bigger dose, or is it the same kind of dose as the Pfizer or Moderna?
So I'm not exactly sure about the dosing aspects of it, but again, the way that a vaccine is created, they're looking for an optimal like immune response. So that's how it gauges like the micrograms component of it. So it's a little bit challenging to say like it's apples to apples, but the key thing to note is that, you know, this is the Novavax vaccine. I think of it, I heard a great analogy. It's like, you know, you get exposed to kind of the eggshell without the egg, you know, and the mRNA is kind of thought about to be the egg, but your body recognizes it as being foreign, and so that you create those antibodies against the spike protein. It was developed to having like 90% effectiveness, which is great, and but we're not sure how well it responds with the latest changes with the subvariants.